DOLA Pro Advanced Customisations. Lateral Arch Pad. A lateral arch pad is a semicircular or semi-dome shaped pad added to the top surface of an orthotic under a top cover for long-term protection. It is highest at the central point of the lateral border and tapers to the edges. It is commonly placed to support the lateral longitudinal arch or lateral column from the calc to the fifth metatarsal head, spanning from the lateral border of the foot and ending at the transition to the medial arch. The DOLA arch pad height and shape has been designed based on feedback from health professionals. DOLA Poron arch pads are self-adhesive with 3M backing tape and are available in 3 sizes: small, medium and large, and in 2 heights, 3 mm and 5 mm, to cover pediatric to adult patients. Selection of arch pad size and height is based on foot morphology and pathology, or the required arch height increase depending on the orthotic lateral arch height and other variables including postings. Lateral arch pad shape. The pad can be left as standard shape out of the packet or customised including the dimensions, the height and widths, or customised with cutouts, apertures or divots based on pathology or to influence foot function. Lateral arch pad positioning. It most commonly runs from the calcaneus to the fifth metatarsal head along the lateral border of the foot, following the lateral arch or lateral column. It spans from the lateral border of the foot, ending at the transition to the medial arch. The high point of the lateral arch pad can be placed as required in relation to the foot morphology, orthotic shell lateral arch characteristics, or pathology. Options include moving from posterior to anterior at the calcaneus-cuboid, cuboid, or fifth metatarsal. Treatment-directed testing. Treatment-directed testing of the lateral arch pad size and position can be performed on the patient's foot, shoe insole, or on the orthotic shell. This can be used to test for the clinical effect, patient tolerance, and comfort. Note: secure with strapping tape or hyperfix to allow adjustment of the arch pad location in your treatment-directed testing. Customized positioning. For a custom position, mark the position required on the patient's foot and transfer to the orthotic. Common markings or anatomical landmarks may include the posterior start point, the anterior end point, the medial end point, and the high point position. Use a pen or lipstick to mark the landmarks on the plantar surface of the foot in a non-weight-bearing position. To transpose the mark onto the DOLA Pro orthotic, position the patient on the orthotic in a weight-bearing position and apply body weight. The marks will now be transposed onto the orthotic shell, giving a guide for the position of the lateral arch pad addition. Lateral arch pad orthotic addition. Select the required arch pad size and height and place the lateral arch pad on the dorsal surface of the orthotic. Secure with strapping tape or hyperfix for treatment-directed testing, or peel and stick with a self-adhesive 3M tape for orthotic manufacture. Protect the Poron arch pad with a top cover for long-term use and dispense. Lateral arch pad. Case examples. In this case example, a size medium 3 mm Poron lateral arch pad was placed on a size small DOLA Pro Soft 70 full-length orthotic shell. The prescription was completed with a 4-degree varus intrinsic rivet post grind and is semi-perforated skin top cover. This prescription was easily completed in clinic for instant dispense. In this case example, a size medium 3 mm Poron lateral arch pad was placed on a size extra small DOLA Pro 70 soft full-length orthotic shell. The prescription was completed with a Poron reverse Morton's extension and a Durafit Lime semi-perforated top cover. Features of this design were used to promote a high gear toe-off pattern and windlass activation. In this case example, a 5 mm size medium Poron lateral arch pad was placed on a size small DOLA Pro 70 soft full-length orthotic shell. The prescription was completed with an EVA full-length 4-degree eversion ramp, and a skin semi-perforated Durafit top cover. The combination of prescription variables aim to improve the lateral stability of a flexible supinated or Cavus foot, who has a history of traumatic ankle sprains and underlying neurological issues. In this case example, a size medium 3mm Poron lateral arch pad was placed on a size medium DOLA Pro soft full-length orthotic shell. The lateral arch pad was placed on top of a dorsal 4-degree forefoot valgus extension. The combination of prescription variables aims to improve the lateral stability and propulsive phase of gait, including the medial transition and windlass mechanism. In this case example, a 5mm size medium Poron lateral arch pad was placed on a size medium DOLA Pro 80 medium density full-length orthotic shell. The anterior position was selected after successful treatment-directed testing of a lateral arch pad on the patient's footwear insole. The patient exhibited a significant flexible forefoot valgus, and the anterior position places the high point of the pad at the styloid fifth metatarsal region. Lateral arch pad prescription. The modification of an orthotic shell with the addition of a lateral arch pad is used to influence foot function and reduce symptoms of various pathologies. It provides Poron under the lateral longitudinal arch or lateral column and will raise the orthotic arch height in this position. It can be used to support the lateral arch or lateral column, to improve orthotic comfort and tolerance, provide lateral support in the pes cavus or flexible supinated foot, in patients with lateral ankle instability or perineal pathologies, increase the orthotic lateral arch height or contour, to alter orthotic lateral arch high point position, or to increase the lateral orthotic reaction force. It uses the material properties of Poron, shape of the pad and position applied to provide cushioning and mechanical change. Lateral arch pad in-clinic modification. Adding a lateral arch pad to an orthotic shell is a common in-clinic modification. The following video will show you how easy it is to add a lateral arch pad in clinic.